During one of my clinical rotations, I had a patient that had a small bowel obstruction. She was 42, and this was the second time that she was admitted with this issue within a month. The first time she was admitted, she had an NG tube placed that she said was not working, so she decided to leave AMA. She then returned within 2 weeks of her very last admission with extreme nausea and vomiting. Her doctors decided to do an X-lap, and post-operatively, she had another NG tube placed. The first night she was my patient, she refused to get up or try to take care of herself, and she still had not had any bowel sounds or bowel movement. I started educating her on the importance of ambulation to help her wake up her bowels, and it would also help with promoting the healing from her incision wound. That first night, we were able to get her walking at least one lap around the unit, which seemed to lift her spirits. By my third shift with this patient, she was able to walk around the unit multiple times. She started feeling better about the care that she was receiving, and we were able to hear bowel sounds, and she eventually had a bowel movement. Ambulation helped with this patient significantly and decreased her length of stay this admission than her previous admission. The article that I found is titled "Fast Track Colorectal Surgery Program Reduces Hospital Length of Stay," published in Clinical Nurse Specialists in July of 2010. This was written by Gail Byard, RN, Dr. Pamela Maxon, Dr. Diane Robleski, and Barbara Luna, RN. The purpose of this study was to compare the outcomes of early ambulation in a fast-track program compared to a traditional program that does not encourage immediate ambulation out of surgery. The study was conducted at a large Midwestern hospital with 200 patients, all over the age of 18, and who had undergone colorectal surgery. They were screened pre-operatively and placed into two different groups, 100 in the fast-track program and the other 100 in the traditional program. Protocol for the fast-track program included ambulation education, ambulating after they'd had surgery, like right after they had surgery, same day, instead of ambulating the next day after surgery like the traditional program does, and staying out of their bed during hours that they are awake. The results of this study was that the patients on the fast track program had reduced their length of stay by 1.21 days shorter than the traditional program. The patient with NG tubes also showed a shorter amount of time on the NG tube than the patients with NG tubes on the traditional program. The implications of this for patient care would be quicker recovery, less post-operative complications, and decreased length of time in the hospital. For healthcare, this means a decreased cost for the care given and patient safety.